Thank you, Dan, and thanks for putting together this meeting. I think it's really timely, and I'm pleased to come and talk about the advancements in health information technology in South Dakota and the adoption and advancement of health information exchange within South Dakota. And I'll try today to give you a little overview of where South Dakota stands on both of those, and then talk a little bit about the state health information exchange. And as Mary just talked about, I think South Dakota typically has used technology very wisely, and mainly because of the rural nature of the state. And it's much easier to get access to those specialists that you may not have within your facility via telehealth or some other resource. So I think South Dakota has been pretty active in that. As you'll see here, this is from a recent SK&A survey done in January of 2015, and South Dakota is number 2 in the nation of physician office usage of EHRs at 72%, so we're just a tiny bit behind Wyoming. So folks in the state have been adopting technology, and we have maintained number 2 for several years in the SK&A surveys. The next shows a progression of hospitals who are adopting electronic health records. So this is the mechanism by which providers are storing your data electronically instead of in paper charts now. I'm sure you all know what that is. But as you can see, 2008, I don't believe that South Dakota was in the 0 to 19%. I think we probably were a little higher even in 2008, but I'm guessing this AHA survey may not have gotten everybody. But as you can see now, fast forward to 2014, and look how it's exploded across the nation, and that's due in part to a couple things, and that is the ERA funding that came out starting in 2009 and created the incentive program, which pays hospitals and providers incentives to adopt electronic health record technology and use it meaningfully, fully in their practices and facilities. As you can see, again, we're number 2 in the nation with the adoption in hospitals at 95%, and we've maintained that for several years. I believe Delaware is at 100%, so we have a little ways to go to get there, but not too far to get there. I did talk briefly about the CMS incentive program, and this shows across the nation providers that have applied for and received funding from the incentive program to adopt the technology within their practice. In 2010, was tapped by Governor Rounds to head up this position of State Health IT Coordinator, and I try to keep an eye around what is going on in the entire state, and then where are we nationally with our peers around the nation. And so South Dakota really ranks highly up there. So you can see these are office-based physicians. 70% of our office-based physicians have received a payment from CMS, so that's a really high number. The next shows hospitals, and we're at 89% of our hospitals have received an incentive payment from CMS. CMS has 2 programs. One is handled by Medicare, so you can receive a Medicare incentive, and the other is handled in South Dakota by the Department of Social Services, and that's Medicaid. So there's a Medicaid incentive you can receive. As a provider, you have to choose one or the other, and if you choose Medicaid, obviously there's some stipulations to the percentages of patients that are Medicaid eligible within your facility. Hospitals, if you're eligible, can apply for both incentives in some cases. The incentive program has brought a lot of dollars to technology in South Dakota, and I think this slide really shows that. Medicare payments, this is through March of 2015, total $93 million to hospitals and eligible providers in our state. And our state Medicaid office has paid out $44 million in incentives. So that's a total of $138 million that have been brought into the state to advance technology. And I think that really shows in our number 2 status for ambulatory or physician-based practices and for the adoption at hospitals. So the next level, really, after you have the technology, is the ability to share that information among various providers outside of your organization, outside of your hospital network. So it begins to break down the silos that exist of information. Those EHRs are really great technology for recording, capturing, retrieving data, but they don't necessarily allow it to be shared across the continuum of care for patients. So health information exchange is that next level. And we began planning for a state health information exchange in 2006, and we launched in 2010. So we went through about a 4-year planning process with our stakeholders, which included our 3 main healthcare systems. Horizon Healthcare at the back has been active. We have the Medical Association, Hospital Association, consumers are represented. So we had a really broad stakeholder group. We partnered with Dakota State to provide some assistance for us in bodies and people to record data and help us as we move through the process. So we've had a great relationship working with Dakota State, and I moved here from here in 2010, so it's easier to work with our staff that we have down here. And one of our team is here, Kathy Christensen is here. She handles our training, and if you've ever implemented direct secure messaging, Kathy probably was working with your facility. But as you can see, this shows that we are in that 80 to 90% of our hospitals are sharing information outside their walls, and that was mainly meaningful use required you to begin to share information. We have helped providers share that information. So this is maybe a little bit of an eye chart to read, but really it just kind of describes what health information exchange is. But it is, as I just explained, it's spreading that information out, making information follow the patient. So if the patient goes, Fulton's a good example. They do a lot of care right there, but if they have to transfer someone out to another level of care, that information can follow that patient electronically and is available wherever they may transfer them. So really it's getting information to follow the patient. And it really does improve the quality of care that patients receive. It increases the efficiency with which you can provide services. And there's also a monetary value attached to it. Payers are getting ever more leery of paying for duplicate tests. So you're able to see that a patient just had a lab that you can use that result, or an x-ray that you can use the result and not have to redo that test. As I said, it makes information available wherever the patient goes. And then really we provide the governance and management of sharing that data. So as an organization, we bring all of the stakeholders together and we agreed upon the way we're going to share data, what data is shared, how we share it. So we really serve in that capacity as well. We are a hybrid federated model, so we do not have a giant repository of clinical data. It's a federated system, so when a query is made, if I show up at a hospital and they query for information on Kevin DeWald, it goes out, grabs that information from all available sources and displays it for the clinical end user, and then once they leave that information goes back to every organization. So it really is a federated model. We worked very hard to develop services based on the need of our stakeholders. HIEs around the nation really have gotten a bad reputation. They typically, a lot of them have closed, failed, but we've been very successful in really meeting the need of our stakeholders, and that is kind of hitting them squarely in the meaningful use basket where they need to share information, and we can provide those services. And we are now looking at expansion of services to continue to meet meaningful use over time. And we also want things that meet the need of every organization. So we get daily requests for very specific analytics or very specific tools, but we really scrutinize those, and we want to provide things that the mass of our membership are looking for. Sure. I mentioned direct secure messaging, and this just gives you some of our statistics. Direct secure messaging is a product that was developed by ONC, Office of National Coordinator, and it really is an ultra-secure email system for sharing healthcare information. So users at each end have to be verified that they are who they say they are, and you can begin to share information. It really replaces anything you'd fax, you can now send via direct secure messaging. Anything you would send in the mail or by courier that's any kind of text document or PDF or image, you can now begin to share. And across 6 states, we provide services in 6 states for direct. We have 150 member organizations, over 2,200 addresses. In 2014, we had 240,000 plus directed transactions. So that's a lot of information flowing electronically that did not flow before. We've connected to 27 other health ISPs, and that really, at the end of the day, we are an ISP like your internet service provider. We provide the secure transport mechanism for those messages. And we've connected to 27 others in multiple states, within the state and surroundings, so that that network begins to grow. And as you can see, this is where we provide direct services within the 6 states that we have. But it doesn't stop there. As you know, healthcare doesn't stop at the border. So this allows anybody that we've connected to with another health ISP information to flow seamlessly to all other states or other locations. The next set of services, which we began offering in 2011, is our point of care exchange, and that is the ability, as I said earlier, to query for information and retrieve it in real time while your patient is sitting right in front of you. It allows people who are authorized to access it to get that information and retrieve it and view it, and it really improves the outcomes of patients and provides better care. We share a lot of different data through the point of care exchange. The top 2 are kind of a document. So if you're familiar with meaningful use, you've heard of a continuity of care document or a consolidated CDA. It really is a snapshot in time of that patient's health care that happened in an encounter. So if they went to a clinic or if they were in a hospital for any reason, there's a continuity of care document is created. We share those continuity of care documents. We share admit, discharge, and transfer data. So this allows you to know when a patient is moving from one location to another. It also allows us to build the Community Master Patient Index that allows us to match patients across our entire community. We have lab results available, X-ray reports are available, transcribed reports, and then we have a 12-month medication history. So the provider can see in the last 12 months all the medication that this patient had. They can also see the fill data from pharmacy. So they can go in and look if their patient for medication adherence maybe didn't pick up one of their prescriptions. They're able to see that with the medication history. Here are our numbers on point of care. We provide point of care services in 5 states. We have 35 organizations, and that represents 64 hospitals and over 300 clinics. We have about 18 of those completed. Of those 35 organizations, there are 17 that are in the queue and we're working to get completed by the end of this year. So by the end of this year, all of those facilities will be onboarded. We're also looking at now engaging other provider types, long-term care, dentists, chiropractors. You know, there's all kinds of services that patients receive that really provide a better overall picture of their health care. We have processed, since we went live with a few of our sites late last year, we've processed 13 million transactions. We have 441,000 patients in our Community Master Patient Index, so that's over half the population of the state is in there. We've connected to 12 different EHRs, and there are 715,000 continuity of care documents available for providers to view in our repository. So we have a lot of information in there, and we have folks who are just starting to use it. And we just went through a major upgrade, kind of the look and feel of the system is upgraded. And so folks are just getting into that. And so that's the next wave for us, is moving there. And our network looks something like this, and I would add that Vern and Jay could add another first to their list that they forgot, but they were the first hospital in the state to complete their connection to the point of care exchange. And they completed it before anybody else did. So they were out in this field by themselves, completed and waiting for others to come on board so they could start retrieving information and sharing their information. So I think that's a great testament to what they said with the list of firsts that they had. So I think you should add that one to your list. But this network really, you can see by the spread that we have across the state that if you're in Fulton and you query for information about your patient, if they've been anywhere within this area, you'll pull back the data that may exist from any of those contributing sources, and you'll have that to provide that better level of care to those patients. So we continue to expand and grow our network, but we really have a great community of folks who have adopted this technology in the state. And that, I think, is it, and I almost kept you on time. So, but I'll be around all day, so if you have questions, please look me up. Thanks.